Welcome to today's talk about ICD and Pacemaker 99. So this is just a basic overview of cardiac devices. So pacemaker, as it says, it just paces, while an ICD will give a shock in addition to having the pace activity. So anyone who has an ICD will definitely have a pacer, and in addition will have the shock capability. While if a patient has a pacemaker, he can only pace but will never get a shock. Why do we give patients a pacemaker versus an ICD? If a patient has any kind of bradyarrhythmia, that will make him symptomatic. If he goes into severe bradycardia or has any kind of AV block that makes it very symptomatic, we will put a pacemaker. But if a patient has a low EF after having multiple heart attacks, and then after you give them medications, his EF does not improve, those patients are known to be at risk of having VT and then going to VFib and then sudden cardiac death. And those are the patients that we have to consider to give an ICD. Now, whenever they ask about a cardiac device, you got to know how many leads does the device have. It can be a single, it can be a double, but they call it dual, or it can be something which is called bi-V. So single, you have one lead, dual, you have two leads, and bi-V, you have three leads. And you can basically figure that out if you're looking at a chest x-ray, just a regular chest x-ray. And all what you have to do is just count how many leads do they have. Let's see, in this picture, you have one lead over here, and you have two leads. So this is what is called a dual. In this abnormal picture, I know that you can see that the patient has two devices, but also in those two devices, he has one lead over here and another lead that is going over here. So this is one way to figure out how many leads the patient has. The other thing that you have to know is by looking at the chest x-ray, you have to figure out where the leads are located. So for example, this lead is going to the RV, right ventricle, while this other lead, it seems that it's going into this position and hooking up to a wall. That wall is the RA, right atrium. Okay, for the bi-V, usually you'll see a lead going in through like this and just staying over there, and that's what we call the left ventricular lead. And you would only see it if a patient has a bi-V device. One of the common questions that you will get from your attending physician on while rotating on medical wards, they will show you an x-ray like this, and they will say, can you figure out what type of a device the patient has? So they're basically asking if the patient has an ICD versus a pacemaker. And I'm going to tell you, this is easy. All what you have to do is look at the lead. And if a lead has a coil that looks very thick than the usual continuation of the lead, this part is the part responsible for shocking the patient. And you can see it also over here. So some leads have it at one area, some leads have it at two areas. This is the part that is responsible for defibrillation. If you see that part on a lead, this means that the patient definitely has an ICD. While if you look at this device on the left side, you look all the way, and there is no thick coil. So this means that this patient has a pacemaker only. Thank you for watching.